Okay, guys, can you hear me now?
Yes.
Yes, sir.
Okay, we have everything recording. So far we have on the line Mr. Howard Fields from the Baltimore campus, right?
Yes.
And we also have Miss Samantha Rotman from the Baltimore campus as well, correct?
Yes, sir.
Okay, we'll give everyone else a little bit more time to start signing in. You're able to see the slides on the screen, the introduction with Mr. Bass's photo, right?
Yes.
Okay. Curtis.
Yep. Yes.
As we proceed, let me know when you want me to change the slide, because if I give you access to that, I won't be able to monitor anyone that asks questions.
Oh, okay. Okay. Sure, that works.
And Samantha and Howard, just so you know, if at any point that you want to ask a question, you should be able to type into the chat. I'm going to monitor those for Mr. Bass as we continue, okay?
Okay.
Okay.
Or feel free to speak up if you have a question.
Sure.
Curtis won't mind if you...
No, I'm good.
Hi, who just joined us? Lauren, can you hear us? Lauren, are you here? Okay, Lauren just dropped off. Hi, Latoya, can you hear me? Latoya, can you hear us? Hi, Lauren. I see you just rejoined us. Can you hear us? You can hear us, right, Howard?
Yes, I can hear you.
Okay. Samantha, you can hear us, right?
Yes, sir.
Latoya, can you hear us? Hi, Alexandria. Hi, Crystal. Christopher, can you hear me?
Sir.
Okay. Which campus are you from?
I'm not. I'm a friend of Curtis Bass, and I just saw the announcement a little while ago, and I was curious.
Great, that's fine. Thank you for joining us. What state are you calling in from?
California.
Okay, great. Thank you for joining us. I'm just taking roll call, that's all. Alexandra, can you hear us?
Yes, I can hear you.
Great. Which campus are you from?
I am an online student.
Great. Do you know what state are you calling from?
Alabama.
Okay, thank you.
Thank
Just
you.
taking roll call. Thank you for joining us, okay?
Okay.
Latoya, can you hear us? Lauren, can you hear us? It seems to be a disconnect that those two can't hear us.
Yes,
but everybody
I can
else.
hear.
Who was this?
Lauren.
Hi, Lauren. How are you?
Hi, I'm good. How are you?
Thank you for joining us. Which campus are you from?
The Baltimore campus. I'm starting classes next month.
Okay, thank you so much for joining us, okay?
Thank you.
Thank you very much. Okay, thank you, Latoya. I just got your message that you can hear us. You just don't have connection to speak. If you need anything, just text me and I'll be able to convey your message to our speaker, okay? If you could type to me, Latoya, which campus you're from. Online, thank you. What state? What state are you calling from, Latoya? Thank you, Virginia. Okay, what city in Virginia? Thank you, Woodbridge. That's where I'm at right now, by the way. I'm at Woodbridge. We have another person coming in. Hi, Professor Solomon. Thank you for joining us.
Hi, how are you?
I'm good.
Good, I'm glad to be here.
Professor Solomon is joining us from London.
Yeah, so it's midnight here.
Oh, wow.
Midnight. Oh, wow. Thank you. So we're getting, it looks like the time is a few minutes after 7. If others join, I'll bring them in. But so far, we have Howard Fields from the Baltimore campus, Samantha Rotman from the Baltimore campus, Lauren Surgery from Baltimore, Latoya here from Woodbridge, Alexandria from online, and she's in Alabama. We have Christopher Rini from California, Professor Solomon from London, and we have Michelle joining us. Can you hear us, Michelle? Okay, everyone, I'm going to go ahead and get things started. We have with us a special guest speaker, Mr. Curtis Bass, and he's going to speak to us tonight about career opportunities in medical billing and coding. I have someone that's just joining. Hi, Talina, I just brought you in. So tonight, Mr. Bass is going to speak with us about career opportunities in medical billing and coding. Just a little bit about him. He is a senior business analyst with United Health Group. He graduated from ATA College in Louisville, Kentucky, and he's going to tell us a little bit about his credentials. So I'm going to go ahead and turn things over to Curtis.
Great. Thanks so much, Dr. Shelby. I really appreciate it. Yes, again, thank you guys, everybody, for joining in this evening. My name is Curtis Bass. I am a certified coder, of course, and also I'm a certified outpatient coder. Back in the day when, whenever I first received my credentials, it used to be, I'm sorry? Yeah. They've changed the credentialing a little bit. Now some of you are aware there's a separation between outpatient and inpatient. Back when I first was certified, it kind of tied both together, so it's changed a little bit. I went to a small college, career college in Louisville, Kentucky. That's where I was from, ATA College, and I did obtain my associate's degree in professional medical coding back in 2011. I was able to sit for the CPC exam in 2010, and then I did the outpatient exam in 2011. All right, and a little bit, I'll give you a little bit of background about my my career path up until now. Before I went to school to be a coder, I was in the Navy. Actually, I lived in Norfolk, and then when I left the Navy, I went into advertising and sales. And then, of course, the economy, took a downturn in 2008. And so I really wasn't sure kind of what to do. So a friend of mine was like, hey, I've got an opening for a receptionist job at my my doctor's office. I'm like, hey, I'll do that. I needed a job, and it was, something different. So while I was there, the manager there was like, hey, I need a certified coder. Would you be interested in going to school to become a coder? And I was like, sure, hey, it sounds great. So I really didn't even know what a medical coder did. So I enrolled in school and was able to work part-time and then go to school in the evenings and then ultimately get my coding degree. I did graduate, like I said, in 2011. And upon my graduating, I was able to get a job with Humana Insurance. Their headquarters is in Louisville. As a coder. Actually, I was as a coding educator. So I didn't even code medical records at the very beginning. I went straight into educating physicians on the importance of coding and how it related to then it was ICD-9 because it was before ICD-10 was implemented. And what I would do, I would travel all over the United States and educate them on audit findings that the actual coders had found, and then provide them with education materials related on how to improve their coding documentation. So that's kind of how I got started. And then ultimately my job with Humana I was able to, they transferred me to Northern California, and then I moved to San Francisco. So as I'll now go through the presentation, I'll just let you know and kind of go over, you know, the kind of opportunities that are available with medical coding. And the good thing about it, you know, they're all over the U.S. So it's kind of an exciting thing to know that something as not to say simple, but as known as medical coding can really kind of take your career into a different direction that you can't even really imagine. So it's kind of an exciting thing to be going into. I'm happy for you all. So you can
Mr.
go
Bass,
ahead.
can I ask a question before we go?
Sure.
What was your driving factor that motivated you most to try to select education or a career in medical billing and coding?
Sure, no, that's a good question. You know, after I had gone and started my schooling, just like everybody here is doing, I asked lots of questions. I was like, okay, so what can this do for me, or what is this going to do? Am I just going to sit in an office all day long and be a coder, or is this going to give me more hands-on training with the medical field and the clinical aspect of it? So, and I've always been really good with speaking to people and very passionate kind of person. So, and I've always been kind of enamored, especially after getting into coding about the medical field. So, without having to get, a medical degree, you're going to be able to, you're going to be learning, anatomy, physiology, all that portion of the medical field that will actually relate directly to coding. And so it was just an exciting thing to go into, and the opportunities even back then, whenever I went through school, it's unfortunately, you're always going to need, there's always going to be a need for medical professionals, of course. And so with the population increasing like it is, and medical coding and billing be as an important of aspect, not only to commercial insurance, but also to Medicare and Medicaid as well too. So the job security portion was actually very enticing for me too, after going through what I did whenever the economy kind of took a downfall. So yeah, so it was just knowing that I'm gonna probably always have a job.
Thank you.
Of course. All right, so you can switch on to the next slide, Dr. Compa. All right, so I know that a lot of you are already aware of the kind of the agenda, the things that we're going to be going over this evening. So the first thing that we're going to really branch into is the benefits of a career in medical insurance and billing and coding. You'll see in the few slides that we're going to get into the endless possibilities of what you can actually get into just by starting this new career field. And then I'm going to kind of briefly go over the different credentials, certifications that are available, both with AAPC and AHIMA. There's several different ones, just depending on which avenue that you go as far as the organization that you get certified in. And then kind of explaining the importance of the degree portion of it. But by getting the degree, just like most people know, sometimes it really doesn't matter what kind of degree you have, but a lot of employers are looking for a degree of some sort. And so so the advantage that you guys have here, you'll be getting that degree and then also hopefully sitting for one of the exams and becoming certified. So you will have, even a better advantage as far as trying to land that, that better job and being more desirable for, for a potential employer. And then I'll just kind of go over some strategies for obtaining the experience, because I know, like myself, I didn't have any experience in the medical field when I got into it. So like I said, I had taken that little job as a receptionist at a doctor's office, and that's kind of what got me started and got me, moving forward with into getting into coding and billing. So, just different things that we'll go over as far as how to gain that experience. And then just some insight for techniques on gaining a career in medical insurance and coding, avenues that you can take, networking, and that sort of thing. So we'll go through that as well too. And then also being able to use the resources that you have available for you at Stratford too. So that's what we'll get into. And just a few things, if you guys have questions, while we're going along, feel free to ask. I'll also leave some time for us at the end to ask more as well too. But if you have anything that you want to know, you can always type it into the chat and let us know, and we can address it then. So, all right, let's move on.
Okay, thank you, Mr. Bass. And
Sure.
Everyone, please feel free to join in, because we do want this to be an interactive session where we hear from you, so that Mr. Bass can actually address your questions and be able to have more of an idea of some of the questions that each of you might have as he progresses. And I do have a few of you, Michelle, Dean, Talina, and Abushrod, that I've typed to you asking for your location and campus, if you could answer back to me in the chat board so I can put you on the attendance list. Thank you.
All right, so thank you, Stephen. So this is something just to kind of think about as we're going through this, you know, that kind of makes, hopefully this is the, you know, the right field and the right fit for you. So, you know, if you're a detailed person, if you want to make your life easier and other people's lives easier, being a medical coder is definitely a great career choice. You know, the qualifications, like I mentioned, are much easier than a doctor or a nurse. But then a medical practice really can't survive without you, because you're kind of the person that's going to help them, you know, kind of like their bread and butter. You know, the more accurate their coding is and their billing, you know, the more money they're going to make ultimately. I know that's kind of a crazy way of associating people being sick with money, but in this case, it really is. You want to make sure that you are coding things accurately, properly, and then the documentation that the physician has, you know, put in the record, that needs to match up with whatever is being billed. So the better coder you are, you know, the higher the reimbursement is going to be, and also the less likely of any kind of a compliance issue in case of an audit that comes along. So that's, you know, that's something to think about. And you know, the jobs that are related to medical coding are rapidly growing, because the business side of healthcare is kind of exploding right now, and it has been over the past few years. And I'll kind of give you a few statistics here in a little bit about how it's growing. It's like, I think it's about a 22 or 28% increase in jobs that are going to be available with this kind of you know, knowledge. So, you know, you've definitely chosen a good career to get into, as far as you know, just lots of opportunity. You know, I've been doing this now about 9 years, and I would have never imagined 9 years ago where I would be today with going through this. So, you know, so the opportunities are really endless, and the business side of healthcare, like I mentioned, is exploding in a lot of different ways. So it's kind of exciting. So just keep, you know, just kind of think about that as we're going through this presentation this evening. All right.
Before we go to the next slide, I want to give a big shout out to Deneen, who's our career services manager. She's in our Baltimore campus, and just want to say thank you for helping getting so many folks from Baltimore on the line. We really appreciate you.
Great. All right, I know this slide's a little busy, but I'll just kind of go through it a little bit briefly. So kind of these are the benefits, like I mentioned a little bit ago, about getting into this career and this path. You know, it's a very rewarding thing to be into, you know, because medical billing specialists and coders, you know, they're a vital portion or a vital part of keeping costs down, you know, reducing medical mistakes. You know, they're ensuring that patients' medical histories are organized, they're correctly recorded, because, you know, as crazy as it may seem, you know, whenever a patient goes from, you know, Dr. Smith, but Dr. Smith is ill and Dr. Jones comes in to take care of this patient, you know, the accuracy of that medical record really makes a difference, especially when another physician becomes involved later in the care of a patient. You know, and a lot of that does have to do with the medical coding and the accuracy, not only that the physician is doing, but also from the coder. So, you know, you're really working kind of hand in hand with the physician to make sure that things are documented properly. So, you know, just keep that in mind, that what you're doing really does make a difference in a lot of ways, not just by keeping costs down, but it also affects, you know, from a patient care perspective as well. And, you know, it's kind of a fast-paced, you know, environment most of the time. You know, it's within the wider healthcare industry. medical records maintenance, medical coding, medical, like medical records, medical coding. All of that is really going through a lot of changes right now. And another thing that's kind of exciting about coding, it's, it is ever changing. They change regulations, they change codes, on a yearly basis, sometimes even more so than a yearly basis, just depending on what the case might be. So it's definitely a way for you to keep, you need to keep on your toes. Plus, you'll be having to, once you obtain a certification, you'll have to keep up with continuing education units. And depending which organization that you go through to obtain your certification, they have opportunities for you to do webinars kind of like this, like what we're doing, attend medical conferences, medical billing and coding conferences throughout the United States. They're actually pretty exciting. It's a great way of networking. So, it's ever changing, lots of changes going on. And so that makes it, a little bit more exciting, because I know that when you look at medical billing and coding and you're like, oh yeah, it's just a bunch of codes, a bunch of letters and numbers associated with a diagnosis. But, there's a lot of other things to it that makes it a little bit more exciting. And, one of the things about it that's even better, which is great, it's such a quick start career or field to get into. Becoming a specialist like a doctor, you have to go through, 4 years of, you have to go to undergrad, and then you have to go to medical school, then you have your residency. All of that, is tied into it. Plus, the cost of going to school, as we all know, is, it's not cheap. So, for you to be able to have a limited amount of education, and to become you'll be the subject matter expert, when it comes to the billing and coding. And so the doctor and the, the nurses, the staff are really going to rely on you to be able to help them out as well too. So keep that in mind. The training and certification, the process most of the time is less than 2 years, 2 to 3 years, depending on how quickly you're going through the program. So yeah, so that's the great thing about it. It's an easy way to get started and really get your career moving forward. Looks like we have a couple questions. Do we have a couple of questions?
Oh, not yet.
Okay, all right, good. All right, and then the other one, like I mentioned, and a little bit, is job security. So like I mentioned, the Bureau of Labor Statistics are estimating that for medical biller and coders, it's gonna rise about 11% between now and 2018 or 2028. So just keep that in mind, and especially with the population, the United States, there's a lot of people. So people are constantly gonna have to go to the doctor, be taken care of, which is just part of it. So the demand for medical billers and coders is high. And like I mentioned, and I will continue to talk about, there's other opportunities and available to you once you get started on this career path. So definitely something to look at as far as sticking with the program, obtaining your degree, and then ultimately getting certified. All right.
Ready for the next slide?
Yep, ready to go. All right, so here I've kind of gone through this, but the benefits, like I said, they continue. So, you're, like I mentioned, catching errors saves lives, and it really does. You can't imagine what that's like. I've been an auditor. I've audited records where things were coded improperly and documented improperly. So it really can make a difference. You're going to work with some incredible people, some very intelligent people, working hand in hand with physicians and nurses, nurse practitioners. It's really an exciting career field to be into. And so, and you're really helping patients behind the scenes, because, patients are smarter than they used to be because of the fact we have the internet. People, you get that explanation of benefits in the mail, and they're going to be able to go on and look to see exactly what's being billed. And why was I billed for something saying I was there for 30 minutes when I was only there for 10 minutes? So, patients are smarter. So you're helping them behind the scenes more than you really know, because you're doing things accurately and properly, and they're not going to really have as many questions because you're on their side. And one of the things that's great also, is location. Medical billers and coders are all over the United States. Depending on where you live now, if or if you're thinking about, hey, maybe someday I want to move someplace new. There's always opportunity with medical billing and coding. And a lot of it too is remote positions. There's a lot of remote positions out there. I'm fortunate. I'm one of those folks that works remotely. I love working remotely. So, there's definitely lots of opportunity, out there for you as far as where you're wanting to be. So you don't really have, if your spouse or significant other gets transferred someplace, a lot of times that's kind of a stressful situation. You're like, how am I going to get a job? What am I going to do? So the good thing about medical billing and coding, there is definitely lots of opportunity out there. In remote positions, popular with about 1 year experience, that's usually about accurate, because somebody that has a little bit of experience on their belt doesn't need hand holding as much. So the quicker that you start working and get that credential and get your experience going, then the quicker you're going to get. You'll realize that you're going to be a little bit more marketable as far as deciding where you want to work, where that be remotely or in person. And another thing with remote positions, flexible shifts. Like I work 5:30 in the morning to like 1:30 in the afternoon, which I love that. I work kind of East Coast hours. I live in California. So it's kind of great. I'm able to do things in the afternoon. I can schedule appointments after work. I'm not having to take personal time off from work to do things like that. So, and a lot of those remote positions that are out there don't really have a set time. They're like, hey, as long as you work this many hours in a week, that's all you need to do. So definitely something to look into, once you get some of that experience, is that the shifts that are very flexible. And the most exciting thing about it that you're going to, a lot of people want to know, hey, how much am I going to get paid for doing this? So, the opportunity and the pay is actually pretty endless. And, depending on where you live, of course, that's always a factor. Demographics is always an issue. Where California, you get paid, maybe you get paid a little bit more, but then as everybody knows, it costs a lot more to live in California. So, but just keeping that in mind, with the kind of schooling that you're going for, the opportunity that's out there with medical billing and coding, the experience that you might be bringing to the table whenever you do get that position, that is always, all of those factors are going to kind of weigh in. But the pay is definitely out there. Like I said, it's pretty endless as far as that's concerned. So just, just keep in mind that you've definitely chosen a really lucrative field to get into, mainly because, we are medical billers and coders are actually in demand. So, you're going to be compensated, well for your knowledge. So just keep that in mind. It's a great thing. And that kind of ties right into the next thing, which is advancement opportunities. I'm a perfect example of that.
Curtis, may I interject for just a few moments? We do have a few questions from some students, and I know you asked me to go ahead and bring those in as they come. So first of all, I just want to retract just a little bit with the great pay. Curtis is correct that there is great pay available in medical insurance billing and coding careers. I just want to reiterate that we at Stratford cannot promise a salary or guarantee a salary. Just for a compliance point, I want to throw that out there, that we do know of a lot of folks that have a lot of success with great pay, but we just don't want to promise anything to you. Then that goes for any programs whatsoever with any schools. We just don't want to promise anything specific. But the first question that I have from some of the folks that are on the line, and you guys are welcome to ask them yourselves in the chat session, but I'll go ahead and do this if you don't feel comfortable asking themselves. We have a student who's trying to locate an externship site, and they've been calling billing companies and they've been calling urgent care offices, and they just haven't had any luck. Sure. Is there any places that you would recommend, Curtis, that could possibly offer externships to students, or even students who are online, might let them do online opportunities for externships? We do have our academic advisors helping with this too. That would be Professor Solomon, and we have Dr. Sheikh, and we have Professor Gorgi that's available to try to help with these types of questions too. And we're going to give you their names and contact information later in the presentation. But since this question come up, I thought maybe Mr. Bass could address that.
No, that's a great question, because I was right there in your shoes and went through the same thing. And what I did, I personally went through, I was lucky and went through the doctor's office ultimately that I was working for before. Of course, I didn't get paid to do it. I was still paid to do my actual job, but then I would come back in the afternoon and sit and kind of shadow the medical coder that was already there. And I did that for about 40, about, it was about, actually about 120 hours total is what I did this externship. And that helped, you know, with as far as removing my apprenticeship on my CPC, on my certified professional coder credential. Another thing that I've seen and I've read lately, especially in the AAPC magazine, the Business Monthly magazine that comes out, a lot of folks are using LinkedIn. LinkedIn is an excellent place to you know, to get your name and your experience out there. And they do have a section in LinkedIn for internships and externships as well. So I would definitely recommend doing that. And then also visiting the AAPC website and the HEMA's website both, because they do have sections on their website for resources. So I would definitely utilize that and check those out too. You don't have to be a member to get on the website to see that information. So I would definitely recommend checking that out too, because a lot of folks do post job opportunities and that sort of thing. So I would definitely utilize those resources.
One of the questions, Curtis, is it better to try specialty doctor's offices or to try to go for general practitioners or orthopedic offices? What would you recommend the most for trying to find an externship in billing and coding?
No, that's another good question. You know, as far as specialty career, you know, specialties, you know, there are specialty credentials available. So it really just depends on you, and it depends on, you know, the office. I think either one would be great because you're still, you know, you're still coding. You would still be billing, whatever the case might be. You know, wherever you can get that, you know, your foot in the door, so to speak, as far as that's concerned. But definitely, regardless of if it's a specialty or not, both of them would definitely be good avenues. You know, just, you know, knocking out, you know, sending out your resume, you know, which we'll get into that a little bit more too. But yeah, either one I think would be fine because you're going to be ultimately doing the same thing. It might be a little bit more specialist versus, you know, like, you know, just an urgent care or family physician or family practice. But I would, yeah, definitely both would be recommended.
What I'd like to do is direct everybody to what I just put on the screen, and we have our academic advisors listed. For the ground students, we have Professor Trezian Gorgi, and I've given her email and phone number, and she's a great asset to be able to try to help sites for our campus students from Woodbridge, Baltimore, Alexandria campuses. And then for the online students, we have Professor Solomon, and she handles students with last names A through L. And Dr. Sheikh handles students with last names I through Z. And we're trying to build a good rapport to be able to have connections with those particular sites that we already have contracts on file for. But if we have students that we don't have something in sight for, we're trying to locate them the best that we can. We're also trying to look out for you before it comes time to you graduating so that we know a little bit in advance to reach out to you a semester or two in advance to try to let you know that that's coming up and what can we do to help you and so forth. So if you feel like you're getting close to graduation, or that last term, you know, reach out to your advisors. Feel free to reach out to myself. I'm Dr. Stephen Tompa, and I've given you my email address and my mobile number both. So feel free to reach out to us. Dr. Ostranger is our university-wide dean. He's more than willing to help as well. So just keep in mind, we'll do what we can to try to help you, okay? Does that answer your question, Deneen? And we do have another question that came in from another student. Let's see, this next question is, for someone just coming out of school, do most places require you to have your certification before that you can get a job?
You know, that really just depends. Since you're just graduating from school, you know, they know that you've gone through the program, you have the information available. I would recommend you taking your your examination, your certification exam as quickly as possible, just for, for a couple reasons. One, the knowledge is going to be fresh in your mind. And then it does, the fact that you have a certification makes you a little bit more marketable or, desirable for an employer. But I mean, a lot of folks will still, I read on job boards and job ads, must obtain certification within 1 year. So a lot of them, they don't actually require you to have it to get hired. They just want you to make sure that you're going to receive it or do that within 1 year. So that's definitely something to look out for. I know actually with United Healthcare, who I work for, they don't require certification right away either. I don't think Humana does. A lot of the insurance companies, they base a lot of it on your previous experience and then your education. So your education is important. So if you have your degree or you're getting ready to graduate, I would definitely recommend applying to places regardless if you have your certification or not, because sometimes it's not the case. They're going to hire you as the person, the individual, and the certification can come later. Because I know a lot of places it is within 1 year, but definitely I would just recommend just to make yourself a little bit more marketable with with the job market, would just be getting that certification as quickly as you can to help alleviate the stress from finding a job, because I know it can be difficult.
So one last question, and that's from Howard, and he is asking, what is the average salary according to the Department of Labor? And this is going to be actually addressed later in Mr. Bass's presentation, and he has some things that he'll cover when we get to that, if you don't mind for us to wait for that question, Howard. Yeah. And Howard's next question was, who is the advisor for the Baltimore campus? And that would be Professor Trezian Gorgi, which her name's at the top left of the screen that's up. And you're also welcome to call me. I'm on the second column at the bottom. So if you have any questions or anything that comes up with that, you're welcome to call either of us. So we'll go back to where Curtis left off.
Oh, you're fine.
And if I didn't answer your questions enough, feel free to text me back and I can get more elaboration for you on those questions, okay? Yeah. I think we left off on the benefits and we were getting ready to start on
credentials. Yep, that's it. So so the two bodies or organizations that deal with professional billing and coding, as far as your certifications, there's the AHIMA, the American Health Insurance or Information Management Association, and then there's the AAPC, the American Association of Professional Coders. So there's those two organizations. I happen to have my credentials through AAPC, and the reason why I do is the school I went to, that's who it was, through AAPC. They're both great organizations. They both offer different types of certifications, and we're going to go over that here in a second briefly. So those are the two, and like I mentioned, the websites for both of them, they're at the end of the presentation. So once you can start looking around and checking out their web. They both have great websites, lots of amazing information regarding this field, job information, questions you might be having, that sort of thing. How to prepare for the certification exam is on both of these websites. Tips of the trade from folks on how to study for the exam too. So yeah, so definitely recommend using those. So if you want to move on, Stephen, we'll go through
to the next slide. One thing I want to just interject real quickly, and Mr. Bass was going to cover this, but I just want to bring this up. On this particular slide, we're directing everyone right now to be thinking about your resume, getting that started, and if you need help, to reach out to Career Services at stratford.edu. Our corporate career services manager told me that she would love to have as many of you contact her as much as possible. Send in your resumes, let us start looking at them, because the sooner you get started on this, the better chance that you'll be able to get yourself placed. But I'll go back to where Curtis left off.
Yep. Yeah, good stuff. Okay, so with AAPC, the number one, the most, not to say the most important, but what most people go for, of course, is their CPC, your Certified Professional Coder. A lot of folks have the COC. I have that one, which is outpatient coding. Then there's inpatient coding, there's risk adjustment coding, which, risk adjustment refers to those Medicare patients. That's what risk adjustment is really for. And then there's actually a certified professional biller credential too, which that's fairly new in their suite of credentials. There's also a certified medical auditor, which actually I'm taking that exam January the 17th, I think it is. to be a professional auditor. And then there's also documentation experts. And then there's also about 18 or 20 specialty courses that are available, depending on, if you want to go in orthopedics or cardiology, radiology. There's a lot of specialty credentials as well available to you. But, if you're coming out of school, fresh out of school, that CPC or now that CPB, the biller and coder, those are the the hot ones to go after as far as AEPC is concerned. And there's great information on their website that tells you how to prepare for the exam, where you can take the exam. I mean, you guys are in, most of you are in probably nice metropolitan areas or someplace relatively close to a larger city, but they have those tests. There's testing sites all over. So, there's information on all of that, how to obtain it, where to go, registering for the exam itself. And then I'm sure that the career services folks will be able to help you out with that too, when it comes time for you to, once you've got your degree, or if you even take the certification, before you've graduated, whatever the case might be. So there's lots of great information on that website. And then AHIMA, same thing. For AHIMA, they have the Certified Coding Associate, the Certified Coding Specialist, and then they have the specialist that is physician-based. There's also a couple specialty certifications. They have the Documentation Improvement Practitioner, the Health Data Analyst, and then they have the Privacy and Security, or the CHPS. And now the other two that AHIMA has, they have the RIA, the Registered Health Information Administrator, and then the Registered Health Information Technician. Those, there's a lot of certifications that are available through AHIMA, but most students, they don't qualify for that because Stratford is still in the process of getting their accreditation from AHIMA for those two particular credentials or certifications. So they're working on that, and I'm sure that more information is going to be available to everybody, as that progresses. So, but there's a lot of opportunity, lots of different credentials and certifications available to you, and that could be something that you add at a later time if you want to. But definitely, whether you do AAPC or AHIMA, you have those certified coding credentials and certifications available to you, whichever route you tend to go.
We have a couple more questions, Curtis.
Sure.
And these pertain to what you're talking about now. This is from Howard, and he's asking, are there any mock examinations that are available that you can do before the actual exam? And if so, how can you get a hold of those?
Yes, that's a fantastic question. I'm glad you asked that, Howard. So both AAPC and AHIMA both have practice examinations available. I'm trying to think, you do have to purchase them, but you can probably be able to find them online, that you don't have to buy them. But I know for a fact that they have the ones that you can purchase. Like you get the study guide, and then and with the study guide comes a set of exams, mock exams. So I definitely recommend getting a hold of them, either if you get them through AAPC or AHIMA, or you can just Google online. I know I went through AAPC and got mine, so and it helped me. If it wasn't for that, I mean, it's a 5-hour and 40-minute test, and I think it was 150 questions, I believe, yes, and 5 hours and 40 minutes. So I definitely recommend studying for it beforehand and getting a hold of those. But yes, those are available for you to take advantage of.
And let me just share too that Professor Gorgie, who is at the Woodbridge campus, she has actually conducted mock exams and some courses to help you prepare for that exam. She's done that back in 2019 and previous years, where she was able to put together a little study guide class. And we had students who attended that, and they did mock exams and so forth. If any of you have interest in that and you need something like that in the future, email me, let me know. We'll see what we can do to try to set something up for you. So be sure to let me know. And then Professor Solomon and Dr. Sheikh might have some information on you in classes that they teach. Let me see if Professor Solomon can. Professor Solomon, can you hear me?
Yeah.
Can you answer that a little bit about, do you and Dr. Sheikh sometimes offer mock exams in your classes?
We do, actually, especially with the MIB classes. We have, something like mock exams, or like a lab test questions that we have. So students can get to practice it as many times as they want and see how they do with the coding tests. So yes, we do, to answer.
Okay. So do you actually have any that you can distribute to students by chance?
I don't have one that I distribute. It's implemented within the class,
Okay.
but we could probably find something that was given in the previous years. I could look for that, but I don't have
Okay.
it at the moment.
All
Yeah.
right. I'll send you some names of some students that are asking, and maybe we can help connect you with them. They're Baltimore campus students, but we'll talk more about that later. Okay.
Okay.
And then one more question that we had that came in, Curtis, was some of the students are asking if they can have copies of these slides, and the answer to that is yes. I plan to email these out to you after the session is over. If you could type in your email address to the chat box for me so I can make sure that I have your email address if you would like copies of the slides, and I'll be happy to be able to send these to you. I plan to send them to everybody, but please type in your email address specifically if you want these, okay? And I'll turn them back to Curtis now.
No, that's great. Yeah. All right, we can go. Yeah. So here we go. So why the importance of a degree and a certification? So you're enrolled in school. You're headed toward that degree. You think of dollar signs. With the degree, I'm going to make more money. So that's true. I mean, you will. The opportunity for advancement is there for you as you get that experience under your belt, proving yourself as a coder or a biller. The more knowledge you have, the more you bring to the table. Yes, advancement. And then probably one of the most important things that people ask about too, like we've mentioned, is job mobility, being able to move, being able to go places, working remotely. If you have an opportunity to go someplace else, that's definitely there. So, your career is on the right path. There's a lot of stability in this industry with medical billing and coding. And then, like I said, it's a good career to get into. It's a lucrative career to get into, and something that that's easily obtainable as far as a good career moving forward. So we can go on to the next one, Stephen. There's a little bit more detail. So advancing your education. So you have those dreams of possibly being in a leadership role, or you want to know how far, or how to find out how far you can take your position in the workplace. If you're planning on continuing your education, you're wanting to work in a management position, your medical billing and coding experience is definitely going to make that possible for you. I'm living proof that it happens. There's an increased demand for managers and billers, for managers in this field too. And that's going to give you a heads up or a hands up, as having that firsthand experience with being a biller and a coder. Because if you go online right now on like Indeed or not really Monster anymore, but LinkedIn, you'll see a lot of opportunities for managers out there. So definitely something to aspire to. The more experience you have, keeping up with your education, those certifications, the opportunity is definitely there for you. And just because you've earned that degree doesn't mean that you need to stop learning. Being a member of the medical community, there's always a way to grow and evolve. Serving both professionals, both of the professionals and with the patients that you come in contact with, as you're dealing with their records. So, so just keep that in mind. If things are changing, the more knowledge you have, the better in the long run. And everybody always knows that, knowledge is power as far as that's concerned. And it definitely plays a part into medical billing and coding too. So the opportunities are really out there for you to get to. You just need to stick with it. The more certifications that you have, you're here, you are getting your associate's degree and, in medical billing and coding, you can move on into your bachelor's degree as well after that. So there's definitely opportunity, in this field, and it's a lot easier to obtain than you think. I'm telling you that right now. It's much easier than you think, because I know I keep mentioning that, but I'm firsthand experience on how this really has changed my career path. In the past 9 years, I've come a long way in the past 9 years. So
Curtis,
it's
let me
definitely something
interject.
exciting.
We just had a question we had a comment from one of our students. It was Mr. Howard Fields mentioning that this is great that he just signed on to the health information management program that we have.
Oh, that's
Let
great.
me just share with you guys that the associate degree in medical billing and coding is a good stair step to that bachelor's degree in health information management because many of the classes overlap. So if you've taken those first 20 classes to get your associate's degree, some of those classes will overlap to the bachelor's degree. You have to have 40 classes in that. So it's a good stair step to get to your bachelor's degree too.
Yeah, that's great. That's a great thing to hear. So, and so Howard, you're going to be one of those people that really, you'll have a leg up as far as having that, that extra degree and hopefully adding a certification along with it. So good for you. So I know a lot of folks want to know what the money situation is involved, and like I said, we can't really promise you anything in particular, because every place is different. But this is just based on an average, and this information I got right off of the APC website. It's coming from, from all the members that are part of the APC. Demographics is a big play into it. Where you live, the amount of years of experience you have, and the types of certifications, that you have along with it too. That plays a big part in it as well. The American Health Information Management Association averages that the salary of a medical coder based off credentials, with one credential being around $51,000, two credentials, you're looking in the ballpark around $57,000, and 3 or more credentials being a little over $66,000. But that does depend on where you're at, where you live. So even if the average, I think the average American salary as a whole is only like $40,000. It might even be $39,000. It's something $40,000 is the average American salary. So right off the bat, with one credential, if you're in that $50,000 range there, you're already above the average American salary. So, so it's not a shabby gig, if you want to put it that way. For the limited amount of education that it requires, the opportunity for making a good living is there. And with the continuing education unit that you're going to be having to do every 2 years, you have to submit a portion. Like I have 2 credentials, I have to do 40 CEUs every 2 years. I just finished doing mine a couple weeks ago. So that's how you keep abreast of all the changes, because like everything else, billing and coding changes rapidly. Medicare is always doing something different. And then, every year we have that new ICD-10 book, the PCS book, your CPT book. Things are constantly changing. So those CEUs will help you, keep abreast of that. And then as far as the credentials are concerning, one credential is a pretty good, amount of money. You add a second one to it, that's even better. And then on top of that, with a degree or, either an associate's degree, like you guys are getting after, or even like, Howard's going after that bachelor's degree. So, you can add dollars to these numbers, with those degrees as well too. So this is strictly kind of just based on credentials. So, so the money is definitely out there. And it, a lot of it is just depending on where you're at. But on AAPC, where I got this information, if you want to go on there, whenever you can, there's a salary. It's kind of like a salary maker or a little scenario that you can put in. You can put what state you're from, and it will give you the average salary for that state. So that's on the AAP's website. So you can look in there to see what you think your average is going to be based on that state that you're living in, and that average salary is based on one credential. So you'll see that once you log on to AAPC, they have that, and there's a lot of information on the Bureau, labor statistics, and then also the CMS website. I did get some information on that, the Center for Medicaid Services, that has some of the information too, as far as the medical billing field as well too. So, job-specific education, and training is necessary, of course, to ensure that you're having a successful career. You need to make sure that you have a thorough understanding of anatomy and medical terminology, which I'm sure you're going through those courses, or you might have already gone through that course. I know for myself, I have an anatomy book by my desk, a medical dictionary, because sometimes something will come across me and I'm like, I have no idea what that is. So, and then the ICD-10 books usually are pretty good. They have a lot of references in those books depending on which version that you have. There's several versions that give you, have a dictionary or sort of, that kind of helps you out with that. But I definitely highly recommend a medical dictionary and an anatomy and physiology book, which I'm sure you probably already at least have the anatomy and physiology book, but it doesn't cost too much. Go on Amazon. I definitely recommend that medical dictionary to help you out too. And then the most important thing, if I say anything about as far as your books, is being familiar with your code book. Knowing where to go in your ICD-10 book for, for specific areas of diagnosis codes. I have mine tabbed. Each section has a tab on it, so I can just flip to it really quickly. Your HCPCS book, making sure that you know that back and forth. And then even the CPT book, it's based on, the index on that one is separated out too. So just making sure that you're familiar with that book, and that's going to help you not only in this, in your career itself, but before you get there, when you're taking that exam, your coding exam, you need to be able to flip through that book quick. So between now and the time that you sit for that exam, become as familiar as possible as you can with those books, because that's going to save your life. I know that sounds kind of like ominous, but it will save your life as far as that's concerned. So I'll stop there. It looks like we have some questions. So
yeah, something I just want to throw out there is I've received email addresses from Howard, Samantha, Michelle, Talina, Christopher, and our Alexandria career office. And for the rest of you, Lauren, Latoya, Deneen, if you want to send me your emails, that would be great, so I can give you this information as well. And those so far are all. So we'll go to the next slide then.
All right, sounds good. Thank you. All right, so this is like, I know we mentioned a little bit about getting your foot in the door. I know I mentioned to try to take that certification test, decide which one it is that you want to do and try to take it as soon as that you can, as soon as you can. It's definitely a challenge. It's not going to be an easy test. It wasn't, but it definitely shows your determination, and your willingness to move forward. A lot of employers, like I said, some of them say that you need it within a year, but if you already have that, that credential, you might not have as much experience. They know that you know your stuff because you've passed that test. I mean, I worked with a doctor that failed it twice before he passed it finally the third time. So, I mean, this is a physician, that you would think that would get a perfect score. So, that really says a lot right there, studying for that test, knowing where to find the information in your book, that's key, like I said. So, and a lot of coders and billers, they start in other related healthcare fields. Like I was a receptionist at at a doctor's office, urgent care actually. And you can use that experience as leverage for getting a billing or coding job. I don't know what everybody's situation is. It's different. Some people are going to school full-time and not working. Some already have a different job, whatever the case might be. But, utilizing your career services folks, trying to find an externship out there, that's going to help too. So anything that you can do to help boost your, resume as far as, a healthcare related field, that's going to be good too. But don't be scared that, hey, I don't have a job in healthcare. I'm going to school and I'm going to be a coder. Don't be scared that you don't have, a job in a related field. So, don't be scared there. Your education and, getting that credential, that certification, that's going to help too. So don't be too worried if you're, I know it's hard now for folks.
Just to interject, we had a comment from a student just now, just to echo what you were saying about using your books and your HCPCS books and all of those to learn the codes. We have a big shout out that goes to Professor Abby Solomon, because one of the students just mentioned they had your class and you made him work really hard and do all of those things that Mr. Bass was just now recommending. So a big shout out goes to Professor Solomon, for all the hard work you're doing to do these things. So thank you.
Thank you.
That's great. Yes. Yeah. Familiarity with that book. I remember I had a girl that had taken the test before me, and she was like, whatever you do, know how to get around in your book, and that will help you take that test. Or even, in class, and once you get to, starting on your job, but it will help the more familiar you are, because that test, like I said, it's a time test. You have 5 hours and 40 minutes, and you don't want to spend all that extra time looking around to find the correct code. So, be familiar with the book. As far as the test itself is concerned, let me finish this real quick, and I'll kind of go give you some tips on that too. So, like I said, try to working in an office or, a front desk of a physician's office, even if that's kind of an externship deal, something like that, making connections, networking with those doctors and providers, that you either work with or that you visit, your own physician, even a dentist office too. People that you visit on a regular basis, if you know anybody that's a nurse, ask them, say, hey, do you know if your office is hiring or might need somebody to, to help out. That kind of stuff is going to help you tremendously as far as getting, some experience in the healthcare field. So some of those positions that kind of, roll up into that, medical records. A lot of places have jobs for filing medical records. Even though most places are still electronic, there are still opportunities for medical record technicians, working in medical records. Front office staff, job shadowing and internships, like you mentioned. You're utilizing AAPC and AHIMA. They both have great resource guides, job boards. And then, of course, your career services folks. I know that Dr. Tompa said that they're really trying to help and work on getting, getting some information, helping folks with getting externships. So that will help. So as far as back to the test, real quick, I know that's not really in the slide, but I'll go ahead and mention it because since we've had some folks talking about utilizing their book, just some tips on the taking the test. Whenever you start taking that test, answer the easy, there's some questions that will take you like 5 seconds to answer, because they're, and everything's multiple choice. Answer as many of those. If you come to a question that you don't quite know the answer to, that you think is going to take you a little bit longer, mark that question, skip it, move on to the next one, move on to the ones that you can answer like that, and that'll bank your time for those questions that take a little bit longer, because there are questions that are a little bit more involved, surgical notes, that sort of thing. So just keep that in mind. If you can answer the easy ones, do that first, and then move back to the, to the ones that are hard. So, just some little tips there as far as taking the test. So, all right. So here's just some information on finding, kind of finding that dream job. Researching the job requirements in your area. Go online and say, and just look at the job opportunities that are out there, and kind of see what their requirements are. Look to see what their particular employers are looking for. If it's education or if it's getting that certification within 1 year. That will kind of give you an idea on what to expect. Plus, it'll probably ease your mind a little bit too, because you're going to realize that maybe that certification isn't necessary to get the job, but you're just going to have to get it. So and some of them will tell you what credentials that you need. That's usually the thing. You'll need CPC, COC, whatever the case might be. They're going to list those there, so you'll kind of know what to look for, and that might help you as far as deciding which credential or which certification test am I going to take. Look at your area, see if it's an area that's concentrated more with AAPC, or if maybe they're an area that's more AHIMA. Some places are different. So just keep that in mind too as you're moving forward before you make that decision. And like I said, after graduation, or even before graduation, I don't know if Dr. Tompa, do you require your students to wait until after graduation to take the test, or can they take it beforehand, or what? I don't know exactly what your procedure is for that at Stratford, but definitely taking.
Abby, can I get you to chime in on that one, Professor Solomon? Professor Solomon.
Yes, sorry.
Can you help reiterate the process on when you have your students take the exam?
When they should have the exam?
Correct.
Well, I always recommend that they do it as soon as possible when they finish the course, because everything is fresh on their mind, and they will have a better outcome out of it. So I recommend highly that they take it right after school.
Great. That's fantastic. I couldn't agree with you anymore with that, because it is going to not only will you have that knowledge still fresh on your mind, but then you're gonna just be a little bit more marketable once you do finally pass that exam, that exam. So and it also can affect your starting salary too, depending on if you have the certification or not. So yeah.
So let me just interrupt. It's great to go ahead and take that right after your classes, so you can go ahead and score as high as you can while the information is fresh in your mind. But what I wanted to share with everyone too, this is being recorded, and I plan to upload it and send everybody a link if you want to rewatch this video. Some of our career services managers had asked about having the slides, which I'm definitely going to give you the slides, but I'll also in the next day or so send you the link to the live recording of this too, okay?
Great. And another thing too, on the test, if you fail it the first time, don't freak out. You'll get information from both, depending on who you take your exam through, and you get to have a retake. There's a retake included with the cost of the test, but it will give you the areas that you. It won't give you the questions, but it'll give you the areas that you failed in, because it's broken into sections. So if you do happen to not pass it the first time, that'll kind of be like, okay, I need to concentrate more on radiology next time, or whatever the case might be. So just keep that in mind too. So if you happen to not pass the first time.
Before we get toward the end, I just want to say I have everyone's email address with the exception of LaToya. If you could send that to me through the chat box, please.
Great. And I know Dr. Tompa talked about this a little bit ago, or kind of when we started, was that the thing that we want, that the career services want you to do, is start getting that resume ready now, which is a fantastic idea. I couldn't agree more with that. They're going to help you, they assist you with writing that resume, showcasing everything that you can do as far as what you've done in the past, and then now your new abilities with going through school. And then they're going to be helping you possibly with some job search and assistance with that, looking at local positions in your area. Utilize those job boards and those online resources too, as far as the websites. LinkedIn, that's another thing too. And my information is going to be at the end of this. Connect with me on LinkedIn. I'll be happy to, follow you on LinkedIn, answer questions to you. LinkedIn is an amazing site for job postings.
Curtis, two questions, Curtis.
Sure.
Does volunteering help with finding a job? And if you volunteer, what type of things should you volunteer for? And do you know places that lets you do volunteering to help boost your resume?
That's a good idea too. I know that a lot of hospitals do have volunteering positions available. I would even ask at the school to see if there's something that you can help out with the school. I don't know if your particular school has, or career services might have volunteer opportunities, helping teachers or other students, maybe tutoring, that sort of thing. Anything that can boost your, your confidence level as far as being a biller or a coder. But yeah, definitely, I would just check around for volunteering opportunities as well too. Definitely with local hospitals and maybe medical clinics. I don't know if there's any teaching hospitals in your area. In the areas of where the students are. I would utilize those too. A lot of the teaching hospitals might be a good avenue to look at as well.
One thing just to keep in mind is some hospitals do require you to, be on board and sign a contract and so forth. So, we can't promise that all of the hospitals will let you do volunteering, but that's something to look into to help boost the resume. Another question, Curtis, is what is the cost associated with taking these exams?
Sure. I think that the CPC exam, I paid for, I think it's $395, I think. I could be wrong. It's around that price. And it does include the retake. But then they also have, like I said, on APC, I know for a fact, they have those practice exams that you can buy, like a test booklet. But hopefully Dr. Solomon and them will be able to, provide you guys with some mock exams. But I'm thinking it's around $395, I believe, is what the cost was. I could be wrong. It's in that ballpark though, because mine was actually paid for through work this time, so I don't know exactly how much it is. I just remember kind of briefly seeing it when I was on the website the other day. But
Most of those, I'm sorry if I may add, most of
Sure.
those information can be found on the website,
Yeah.
the APC, and the current information can be found from there. And I
Great.
suggest students should familiarize themselves with those websites anyways.
Yes,
And
definitely.
going back to the volunteering thing, like Dr. Tampa said, it would be harder to get a volunteer job with medical billing and coding because of like the data issues, security issues, and HIPAA. But however, I always believe that student has to have the end, result in their mind, and what this will really help them with is networking. If they volunteer in the hospitals or anywhere in the medical field, it will help them build the networking, and that will translate into finding their job and path. So if you know where you want to work, that's one way to open gates for you. So I always
Definitely.
recommend that you do that.
Let me just share too that even though you may not be volunteering to do medical billing and coding because of the HIPAA violations, and the hospital lets you volunteer just to push patients in wheelchairs from the front desk to their vehicles, or pass water, pass ice, pass flowers that come in for deliveries, that can always
Yeah.
go on your resume showing
Yep.
that you had volunteership in the healthcare field, which looks good on a resume and shows employers that you really care about patients. And that can be something to help stand yourself out to get that dream job too.
That's exactly right.
Absolutely.
That's so good. Yes. Yeah, because you never know who that person that you might talk to might have. It's all in who you know, and it's kind of crazy how that really works, but it's true. So, and once you get your resume out there and start applying for jobs, the interviews help. Maybe you won't get the job itself, possibly, but the more interviews you go on, one, it's going to boost your confidence because you're selling yourself. You're going to be like, hey, this is what I can do. This is what I've done. I have this degree. I've done this. I've sat for this test, that sort of thing. Just go on as many interviews as you can. Sell yourself. Look professional. Look sharp. Have that great resume that you're going to be, working with the career services team on getting built for you. And that really does help. LinkedIn, I know for sure you can put like my resume is posted out on LinkedIn, and I get phone calls and text messages and emails all the time about, hey, we are inviting you to apply for this job. So, so it does help and it does work. So, there's a lot of great opportunities at your fingertips, job resources and networking. Like Dr. Solomon said, networking is key, and it really is. Anytime that you get a new certification or something new, update that resume. If you don't have one already, it's free to create a LinkedIn profile, and then you can also have the app on your phone too. Get that LinkedIn profile created. Visit the local medical facilities and hospitals. Utilize their job boards. Wherever you might be, get on their website. Look and see what kind of positions that they have out there. And then as far as like online, Indeed.com. They have local jobs and they have a lot of national listings for medical billers and coders. A lot of the remote position opportunities are on Indeed as well. And I know we keep mentioning, Dr. Solomon mentioned it again too, APC and AHIMA. Use their websites. They have those job boards on there. So use that for your advantage too. And then utilizing your school's career center and the folks that are there at your school. They're going to also be a good resource for you as well, and helping you move forward with finding that new job.
So let me share something with you that was posted by Professor Solomon, and that is to set for the CPC exam, that costs $399, and it's only $325 for AAPC students. And that does include you to do one free retake.
Great. Thank you. I wasn't sure the exact amount. I knew it was around that time. So yeah, thank you. Yep. You can go on to the next slide if you want to, Dr. Tampa. All right, so like Dr. Tompa mentioned at the beginning, here's your listing of all of the folks that are on your side working right there along at Stratford. You know, for those ground students, Dr. Gorhey, there's an email address and telephone number. For the online students, Dr. Solomon with the last names of A through L. And then there's for those students, Dr. Sheikh for those that we have a last name of I through Z. You have their contact information. Of course, you have Dr. Tompa's information as well. He's your interim regional director. And then the overall campus dean, Dr. Ostrander, he will be more than happy to help out with any question that you have as well. So, you know, just making sure that you're staying in touch with your academic team. They're going to be able to provide you mentorship and guidance, you know, throughout your time at the school, and also probably after too. So they're definitely a resource to use. I know that I've reached out to my previous school in the past as well too. So they're definitely there to help you out with whatever questions or issues that you might be facing, you know, and be able to be kind of a first-hand resource for you.
So I know all of you have been asking questions and I've been relaying those off to Curtis, but I just wanted to say to you that I'm going to have this downloaded, the whole presentation, and uploaded and send each of you the link. I'll also send each of you copies of the slides, but give me a day or two to get that out to you, and I'll be sure that I do that. If at any point that you have questions that you didn't think about tonight, feel free to email me. My email address is stompa@stratford.edu. I'll be more than happy to get the answers for you. But what I'd like to do now is, I know some of you have been asking in the chat box, but ask your questions now verbally so Curtis can actually answer those for you. Not everybody speak at once.
Don't be shy. I'm a nice guy.
Do I need candy bars to throw out to get everybody to ask questions? Can you guys hear us? Is anybody there?
Did we answer their questions already?
How about comments? Somebody give us a comment. Let us know you're out there.
If you want to go on to that next slide, Stephen, that just kind of gives them some of the references of where I've got the information for the slides. Of course, you know, I mentioned it a gazillion times, AAPC, AHEMA, Indeed. ATA College, that's the college that I went to. I went on there for just a couple of things. And then CMS, cms.gov. And then my contact information is there. So feel free to email me. You can, you know, shoot me a message on LinkedIn. I'll be more than happy to, you know, to connect with you on LinkedIn and help you out. You know, I don't have any issue helping people with finding a job, or any questions that you might have about the test when it comes time for taking that test. Let me know. I'll share my experience with you a little bit more and give you some tips on what to prepare for. So I'll be happy to help you out.
All right, and some of these might have been muted. I'm making sure everybody's unmuted. So please speak out so we can hear you guys. We're not sure if you can hear us. So try, somebody speak a Howard, are you out there?
I am.
All right, give us some feedback, Howard.
This is great information for me as I enter into my externship. I've been asking these questions all along the way, but this was necessary and timely as I entered to externship. Like I had said in the group chat, that I am entering into the management program, and I'm excited for what this is going to afford me as I change careers. Thank you again.
You're welcome.
Okay, let's just go down the list. Michelle, can you hear us? Samantha, how about you?
Yes. I'm just overwhelmed by the information because this is my first time into something like this, and I'm really looking forward to using the information that I've taken from this presentation and using it as I go forward.
Great. That's great. That's great. Yeah, reach out with any questions that you have as you continue moving forward. That's where everybody's here to help you out.
Michelle, how about some feedback?
Everything was very informational, and I guess Howard had answered some of the questions that I had because I was curious also too. So yeah, thank you very much.
You're welcome.
Okay, Christopher, how about some feedback?
That was a lot to cover. Thanks for getting so much done in so little time.
You're welcome. Thank you. Glad you joined us.
And Deneen. Deneen, can you hear us? Talina?
Hi, yes, thank you, Mr. Bass, for providing us with this information. It was very informative. I think when I first started the medical coding and billing class, I was intimidated when I got that ICD 910 book.
Right.
With, you know, as much medical experience I have, that book intimidated me.
I can imagine.
So it's coming along. It's been a little, you know, a little hard, but
Sure.
I'm gonna get through this program. I'm determined. I've always did more of bedside manner in the medical field, and I do have a lot of front desk experience. I was an office manager for like almost 30 something years. So I do have a lot of medical background, but I just wanted to do something different. So I'm looking forward to, you know, starting this new journey of mine.
That's great. I'm happy to hear that. Yeah, you've definitely, that experience is going to help you so much. So don't let that book intimidate you too bad. Just get familiar with it and you'll be good.
Okay, great. Thank you.
You're welcome.
Any others that want to give any feedback?
I just wanted to say that all the information was very helpful, being as though I start classes on January 6th. So I'm not in the program yet, but I am very excited, and I do as well have some healthcare experience. I work as a patient service representative.
Nice.
And I've been at a hospital for about 8 years now. So I do, you know, I have some medical terminology, but not as much as I want. So now I am very excited to get this started.
That's great.
This is Lauren, right?
Yes.
Okay. Best of luck to you, Lauren, okay?
Thank you. And thank you so much for having this because it was very helpful. And I'm glad I joined.
I'm glad you did too. Thank you. It's great.
So as you guys have questions and so forth, I brought back the screen with the academic advisors. Just make sure you have these names. Professor Gorgie, Professor Solomon, Dr. Sheikh, myself, Dr. Ostranger. We're more than willing to help you any way that we can. And if you want to reach out to Curtis, his number is curtisbass73@gmail.com. But if Stratford related questions, please contact one of us because we will do that. Curtis is with, he volunteered his time to do this guest presentation from the community for all of you, and he's located in San Francisco, right, Curtis?
Yeah, between San Francisco and Los Angeles now. So yep.
Right, and even though I'm in Woodbridge, feel free to reach out to me. You know, I can schedule time with you through Zoom, or connect you with Professor Solomon or Professor Sheikh or Professor Gorgie to get the answers that you need. Okay.
Thank you.
I want to thank each of you for all of your time tonight, for joining us. But most of all, let's just give Mr. Bass a big round of applause for giving his time to us.
Oh, you're welcome.
Yes, thank you.
You're welcome. It was my pleasure. I was excited to do this. So you're welcome.
And I will get you the link to the recording and the slides, and see what I can do about practice exams for any of you, and try to get that out in the near future. Give me a couple of days to get that together, but I'll get something to you in the near future. Does that sound okay, everybody?
Yes.
Yes, we appreciate it.
Thank you very much. Do you have any final closings, Curtis?
Just making sure that you're utilizing these advisors. They're going to be able to, be your first point of contact as far as moving forward with any questions that you have. you know, because they're on your side, they want you to be as successful as possible with this too. And then, you know, reach out to me, like I said, if you have questions, and you know, to start using the, you know, start using the APC and AHIMA's websites, getting familiar with them. There's so much information on both of those sites that are going to be able to help you move forward with making your decision on which way you want to go. So there's a lot of great information out there at your fingertips. Just, you know, just make sure and utilize it.
I just want to say one last thing to all of you is that some of you, you know, I heard some of you sound a little bit scared, a little bit afraid of the future. Just know that you can do this, and Stratford will help you get through this. Just let us know. And but in closing, I don't want to keep I want to be respectful of everyone's time since it's almost 8:30. We've been on about 90 minutes now. The most thing that I want to say to each of you is have a happy holidays. Enjoy your time with your family and your friends. And thank all of you for your time tonight. Thank you very much.
Thank you. Happy
Thank
holidays
you.
to you too.
Thank you very, very much. Thank you. I'm going to go ahead and close the session, but thank you very much, everyone. Email me with questions, stompa@stratford.edu.
Thank you, Dr.
Thank you.